So next I'd like to talk about something we call research segmentation. And research segmentation and needs kind of go hand in hand. Needs are owned by a cast of people that we call stakeholders. And these are people who, to a lesser or greater extent, care about a solution, care about what we do. Those are what we call stakeholders. We tend to, in industry and in common parlance, focus on customers. I need to make my customer happy. But in many cases, there are more people than just a customer involved in how successful a product is going to be. So who are these stakeholders? Well, who are the stakeholders in an operating room for a scalpel? Something we're all familiar with, a scalpel for cutting. Well, obviously the patient is probably on the receiving end of a scalpel. That's the person that's going to have an incision made or something, a cancer or something removed. So the patient is a stakeholder. But generally, when there's a scalpel around and a patient around, the patient is unconscious, the patient is asleep, the patient is under anesthesia. So although they're a stakeholder, they're actually not a very weighty stakeholder in this case. The surgeon, however, absolutely a major stakeholder. He's going to use this. So who do we design the product for? Do we design it for a patient? Well, they don't care. Do we design it for a surgeon? Yes, absolutely. It has to work for a surgeon. But hang on a minute. If you've ever stood in an operating room, you'll also see that there are nurses, scrub nurses, particularly that person behind the surgeon who's preparing instruments, assembling maybe different blades onto scalpel handles and handing them to the surgeon for the surgeon to use. So the nurse is interacting with this product an awful lot as well. So probably the nurse has a vote in what good looks like in a solution. And then, interestingly, I've added one more here, the medical student, because we tend to think of doctors as being highly skilled people, surgeons with 20 years experience are going to do your surgery and you'll be fine. But they started out as medical students who were much less adept, much less capable, much less dexterous. So this scalpel has got to work for somebody with 20 or 30 years experience and somebody with 2 or 3 weeks. So that makes for an interesting product. Then, of course, there's hospital management. Hospital management wants scalpels to be good, they want them to be sharp, they want them to be risk-free, they want them to be effective, and they want them to be cost-competitive and all of those things. So they have a vote. The hospital sterilization department, probably something you don't necessarily think about, but down in the basement of every hospital in every part of the world, there's somebody cleaning equipment, recycling it, and sending it back up to the operating room through autoclaving and sterilization. So they have to deal with this scalpel. Maybe they have to disassemble the blade. They have to be able to clean it effectively and know that it's clean and send it back up to the operating room the next day. So they have a vote. Then there's the purchasing department. They've got to buy lots of them. They've got to buy different sizes, they've got to buy them for left-handed, right-handed, different utilities, small surgeries, big surgeries, children, not children. So they have quite a challenge ahead of them, making sure that they've got the right product in the right place at the right time for the surgeon. So a good solution should actually try and meet the needs of all of the stakeholders that it's going to interact with. And some are more important than others, absolutely. But to ignore all of them and just concentrate on the customer is a dangerous thing to do, because as you can see, who in this case is actually the customer? Thinking about a nurse, for example, maybe we established that a nurse is a stakeholder in the design of a product or a service and what good is going to look like. That also poses further questions, if you think about it, because not all nurses are the same. What type of nurse? Well, we have scrub nurses, we have operating room nurses, we have pediatric nurses, we have ICU nurses, we have tech nurses like anesthesiologist nurses, all manner of different nursing disciplines. So what type of nurses we want to talk to or understand? And then how many years experience? 20, 30 years experience or 2? Somebody freshly minted from nursing school, right up to date with all the latest technology, or somebody with years of experience who's figured out how to make things work. So this introduces many more factors. And if we multiply that by all of those different stakeholders, patients, nurses, purchasing, sterilization, medical student, all of those people, you can see that there are now lots of inputs to this equation. And we capture those in something that we call a research segmentation that defines the scope of our research. And it answers these questions. Which stakeholders and which subsets of stakeholders? Working where? Where are they doing this thing? Now, they might be working in hospital, or they might be digging a hole in the street or on the interstate. So where are they? Which countries? And are countries going to be different? They could well be. Cultural differences and differences in practice could mean that a product that works here doesn't work in China and vice versa. And then how many of these people do we want to interact with? How many do we want to observe or interview? How many do we want to talk to? Well, 1, that doesn't sound like a robust answer, does it? 100, that sounds impossible. So there's some kind of number in there that we need to be comfortable with. Remembering that needs finding is qualitative market research. It's not quantitative in its first iteration. It may become quantitative later on once we've narrowed down, but it starts off in the qualitative realm. So we're not looking for huge numbers here, we're looking for richness of data and insight. So this is a simple example of a research segmentation. And you notice across the top that I've got USA, UK, and China as the countries that I might want to investigate. Now, obviously, and then down the left-hand side there, I've got a list of stakeholders. People. I've gone with nurses, and I've subdivided those into different levels of experience. Less than 5 years and greater than 5 years. Surgeons, I've subdivided further. Patients, under 30 and over 30, and I've included hospital managers. And I've included hospital managers at small hospitals, less than 100 beds, and hospital managers at larger hospitals, kind of over 600 or whatever. And you'll notice in the table, I've put numbers. Now, what's the right number? Basically, 3 is a very good place to start because it gives you triangulation. If you've got one person saying it should be blue and one person saying it should be red, if you have a third person, you have something of a tiebreaker. If you can go to 5, even better. Now you're beginning to be able to look at trend. So 3 is a golden number. If I put 3 in all of the boxes on this research segmentation, that would be a lot of stakeholders that we're going to talk to and interact with. So sometimes we dilute that down to, well, where am I going to see differences? I'll look at 3 everywhere, but where am I going to see differences? I might drop to 1 or 2 there just to see if anything different happens in China or to see if anything different happens in the UK. And I might also look at who's important here. Well, I know nurses are important. I know patients in this case are particularly important, so I'm going to talk to more of them, but I'm going to talk to fewer hospital managers, maybe because this is an outpatient thing, and maybe it's not so important to hospital management. So that's a research segmentation. And really, its primary purpose is to force us to think about, am I looking at this problem in the round? Who is involved? Where are they? And am I considering all of the influencing factors on where these needs are and how I can find them and make sure that I can be confident in my answers?